So hello and welcome to this Nolex webinar. I'm Paul Anthony. I'm the conference producer here at Nolex, where we disseminate healthcare information, and that is via our training modules, our conferences, social media, and of course via our webinars. Today's webinar, titled Hand Hygiene Inside the Science, it's going to focus on getting the most critical aspect of your infection control regime right. Before we go to the webinar, I've got some housekeeping. Can I please ask you that you don't share any of the presentation slides from today on social media, and please don't take any screen grabs either of the presentation slides with anybody else. There will be a PDF version of the slides available to download after the webinar is finished, and we do have all your emails, so we'll email you directly when the PDF version of the slides are available on the website. During the webinar, you will be able to ask questions. You can type them into the chat box, which you'll find on the right-hand side of your screen. We'll try and answer all your questions during the session, but if we don't manage to do that, then our speakers will answer them by email after the webinar is finished. Also, the webinar is being recorded. We understand that you've got jobs to do, so if for any reason you have to leave before the end, you can watch it again at your leisure, and that'll be from Friday of next week. You can also play it to your colleagues as well if you wish. So let's crack on. The webinar today is going to focus on how to combat the spread of infection within the healthcare setting. Of course, exemplary hygiene is of critical importance. How frequently hands are washed and how they're washed does make a difference. One element that's often overlooked is how they're actually dried, and this is key to preventing the spread of infection. So today we've got two renowned global experts. We've got Marc Van Ranst, MD, PhD, Professor in Clinical and Epidemiological Virology, and Mark Wilcox OBE, Professor of Medical Microbiology, who both analysed and condensed 15 years of research and are here today to present you with the real evidence and to inform about hand hygiene best practice. So first of all, let me introduce you to Marc Van Ranst, who joins us from Belgium.
Hi there. Good afternoon. I will share my presentation, and if everything goes well, then you will see my slides on the screen. And my task is basically to introduce Marc Wilcox, but I will try to set the scene. We will be talking about hand hygiene, and hand hygiene has been always a very important topic. However, in antiquity, we don't really know too much about it. This is one of the earliest depictions, and it's from Crete on the back of a sarcophagus about 1400 before Christ. And here you can see a person after sacrificing an ox, and she's obviously a priestess washing her hands. So that was in Crete 1400 before Christ. We know that Pontius Pilate washed his hands in innocence when he convicted Jesus or chose Barabbas to free Barabbas, and here you can see the washing of the hands there. In the Middle Ages, we know that people were washing hands, and very often hand washing was done not really for hygienic reasons, but for more ceremonial, religious reasons. This is an aquamnil from the 9th century in Persia. They've been found later on all over the globe that was filled with water that then could be poured over the hands. This is a depiction from 1320 of the Romans of Tristan and Isolde, where people obviously are washing their hands in the 14th century, and you can see the first depiction of hand drying with a person carrying a cloth hand drying device. We know that afterwards, in the later Middle Ages, hygiene was very often lost. This is King Louis XIV, the Sun King, who lived in Versailles, and he was notorious for having bathed twice in his life. The second time he washed himself on the advice of his physician because he had a series of very bad headaches. The bath didn't relieve the headache, so he stopped bathing altogether. So that was problematic. So hand hygiene was sort of lost for a long period in history, and that only came back in the 19th century with Ignaz Philipp Semmelweis, who was an Hungarian gynecologist who worked at that time in Vienna. And he noticed that the mortality amongst women who just delivered their baby was extremely high. And he could distinguish two different gynecological wards. One which was staffed by physicians, and there you could see that the percentage of fatalities after birth in the mothers was almost 10%. And then you had the midwives division that and these midwives were washing their hands much more frequently, and they had a mortality of in the women who delivered their babies that was about 3 times lower. So he advised, and he was still very young when he started doing that. He was about less than 30 years old. He started to implement stringent hand washing policies with chlorinated water, and could bring down even in the division that was staffed by the physicians, the childbed fever mortality rates from very high percentages to percentages that were more normal, or more definitely lower. He was not believed at that time. His colleagues were not very sympathetic towards Semmelweis. They didn't believe him. They thought that physicians could not have dirty hands, and during his life, he died very early on. He became mentally ill, very disappointed in his profession and his colleagues, and he died of a wound infection in a mental hospital. But later on, his students picked up the work of Semmelweis, and he became only famous after he died. That was followed by Florence Nightingale, who was a real powerhouse, in the political powerhouse, also in the 19th century in London. She was very instrumental in bringing nursing to a much higher level. And in 1860, she wrote a book, Notes on Nursing, really the first decent textbook on nursing techniques, where she said every nurse ought to be careful to wash their hands frequently during the day. And that became extremely influential, and was the real beginning of hand hygiene in nursing. She was also a very accomplished mathematician, statistician. These sort of plots were her invention. They came from the Korean War in 1853 to 1856, where the red part is the army, or the battle-related wounds. Black are all other kinds of mortality, and in blue you have infectious diseases, very often wound infections, and also during the winter season, respiratory infections. And she was one of the first to follow up on the work of Semmelweis to bring hygiene, and definitely also hand hygiene, to a higher level. I'm sure you're still very aware that we passed a couple of very hectic years during the pandemic, where people really were bombarded with pictures like this, where it became very obvious that respiratory diseases are transmitted by these smaller and bigger droplets that can stay aloft for quite a while. And that struck a chord in the population. People understand now much better that when you get a cold, when you get flu, when you get COVID-19, that you get it from somebody else who transmitted particles in some way, and that way can be very directly by just sneezing into your, although it's not advised to do that, into your hands. And that's how you contaminate your hands. And that is why hand washing is extremely important in mitigating infectious diseases. The process of hand drying is very well described on how long and how you should wash your hands. It's not always followed, these advices, but they're extremely clear. And in the past, the hand drying part was sort of neglected. It was taken for granted that, yeah, you would have to dry your hands afterwards. Now we know that hand drying is an integral part of the hand washing routine, and this is an important step. and worthy of study. And this is now where Marc Wilcox comes in. He's one of my scientific heroes. I admire him a lot. He's the National Clinical Director for Antimicrobial Resistance and Infection Prevention and Control for NHS England, Professor of Medical Microbiology at the University of Leeds, and basically has been very instrumental in bringing the field of hand drying to a higher level. And we're looking forward to a presentation of, well, the work that has been done in over the past 15 years on hand drying. So here I would yield the floor to Professor Marc Wilcox.
Thanks very much, Mark. Mark with a C as opposed to Mark with a K, which is me. That was very kind of you to say what you did. So thank you. I'm now going to share my screen, and let's hope this works. Yeah, but I want that as a presentation mode.
We can see your screen, Mark.
Can you see the? Is it filling the screen, or
yeah.
Is it just? It is.
It's fine.
Ah, okay, all right. I didn't realise that. That's fine. Okay, in which case, let's go. So thank you ever so much to the 400 or so people who joined this webinar live today, with more still joining. I'm going to try and compress a 15-year story, which normally takes me about an hour to tell, into 45, 50 minutes or so. So I'm going to have to move quite quickly through the presentation, but hopefully you'll follow the logic of the story, of the route map that has been taken to understand more about this area. And I'm going to show you on several occasions this route map, but I'm going to bring in the labels for the specific points along the route that have been significant steps forwards in understanding the hand drying story. And I will start just really by taking on the theme that Mark has just mentioned, about that hand drying has somewhat been the poor relation to hand washing and hand hygiene. And I've done 3 searches here, PubMed searches. The one on the right shows 1,000+ hits for hand drying, and you contrast that with the 80,000 hits for hand washing or hand hygiene. So really there's been far more attention, far approximately 70 to 80-fold more, if you take those numbers on face value, on washing rather than drying. Having said that, when you look at the graphs within each of these PubMed searches, you can see a takeoff, an increasing level of interest, even with hand drying. And that's partly because of this story, 15-year story that I'm going to tell today. And I'm going to start by describing some early work that dates from the noughties, that was largely carried out by a colleague and has become a friend, Keith Redway, Professor Keith Redway. Keith has retired now, but is still an advocate for this story. So I'm going to importantly describe Keith's contribution, Keith and his team's contribution to the story, and in particular starting off with a report that I've just brought in on this slide build, and more of that in a minute. I'm then going to describe some of the work that my group have done, my team have done, based in Leeds and beyond. Importantly, I will describe a real world study, and I will emphasize why that real world study is crucial in understanding whether you believe there is an issue here with certain hand drying methods or not, because it's hard to ignore the real world studies. You can argue about the methods that might be used in vitro concocted studies, but real world is real world. More of that to follow. I'm also going to mention some other studies that have neither been done by Keith Redway's group in University of Westminster, nor by my group in Leeds. So this is where the story starts. It was an early report that Keith produced in 2008, and then he built on that and produced this second report in 2012. And what Keith had done in those sort of 4 or 5 years was a series of, I would describe them as simple studies. And like many things that are simple in science, simplicity is elegance. And Keith's studies certainly were elegant. They were in vitro studies, and I'm going to work through those. And importantly, he compared 4 different hand drying methods. So paper towels, the rollers, the material rollers that you don't see very often in the UK now. You do see them sometimes in other countries still. Warm air dryers, the types of dryers that we all love. Is it love to hate? Is that fair? How, you know, you put your hands under them, and quite an age later, you're still waiting for them to be, your hands to be dried. And of course, jet air dryers. So how do the hand drying methods compare in terms of doing what they're meant to do, which is drying your hands, removing water? They're removing water in very different ways. That's the very first thing to observe. Some of them are absorbing water. Some of them are trying to dry the water. Others are trying to blast, shear the water off the hands. And if you compare essentially the axis here is the y-axis, is the level of dryness of the hands, and the x-axis is time. And what these show is that jet air dryers, those continuous material rollers, and paper towels are equally good at drying the hands. By contrast, the warm air dryer, which is the bottom curve here, takes ages to get to a state of dryness that has been achieved within maybe 15-20 seconds or so with jet air dryers or paper towels, etc. So it takes about a minute for a typical warm air dryer to achieve the same level of dryness. Now, a controversial, and there are several controversial issues in what I'm talking about today, but one of those is, what's the relative ability of those methods, those hand drying methods, to remove microbes that are on the hands? And to cut a long story short, there's probably not a lot of difference overall in terms of the efficiency at removing microbes from the hands. But there are 2 caveats there. The first caveat is that warm air dryers do appear to be different. You can imagine that if you're passing warm air over hands that are moist, and that it's possible that you might actually increase the amount of microbes on those hands in the minute or so it might take to dry those hands, because some of those microbes are going to multiply and so on, but also just not a very efficient way of getting rid of water, droplets, etc., and indeed microbes from the hands. And this experiment suggests that warm air dryers were associated with an increase in microbes, whereas the other methods essentially were not, and were all much of a muchness. However, where have the microbes gone when you consider these other methods? Have they gone onto the paper towels, been absorbed onto the paper towels, rubbed onto the paper towels, and then hopefully put into the bin? Or have they been sheared off the hands and spread elsewhere in the washroom? And I'll show you the answer to that question through a series of studies shortly. So we've answered that first significant point on the roadmap. Next, how do hand drying methods compare in terms of droplet, not microbe dispersal yet, but droplet dispersal risk? And Keith's experiments, and he used various different experiments, some by dipping hands into lemon juice, which is a weak acid, and then drying the hands, and then using an indicator to see where any lemon juice droplets had gone to during the hand drying process. He also did the same thing by dipping hands into a solution containing a yeast. And he had this stylized figure going from zone 1, you can see on the right, to zone 6 at the bottom. And he would either use different ways of visualizing the lemon juice by using an indicator, or by putting plates that would subsequently grow yeasts if the yeasts had been deposited on zone 1, 2, 3, and so on. And you can see the laboratory setup on the left here, and you can see in the middle here the development of the lemon juice droplets, and you can see where the lemon juice droplets by those have been deposited, which is largely on the trunk of an adult and the upper trunk stroke face of a small adult or child, as shown here. And that's in relation to this particular jet air dryer, more of which to come. So that's droplets, but of course the droplets can contain microbes, and the microbes may be in big droplets, small droplets, and they may be simply sitting on the surface of the cornified epithelium of the hands. But what about the dispersal of those? And this is, you can see here, the development. This is capturing yeasts by putting these different yeast Sabarodes agar plates across this figure, up and down this figure, subsequently removing those plates, culturing them, and then you count the numbers of yeast colonies. You can do similar experiments and look for the distance travelled, in this case laterally, by looking at lemon juice dispersal across these circular discs. And then you can draw up results, a results table like this. And don't worry, I'm not going to go through this. There's a lot of data here. I simply want to make 2 points. Point 1, as you move down the table, particularly to the bottom of the table, to the rows involving the jet air dryer, that's where you see the high numbers. The numbers are either the numbers of lemon juice droplets or yeast colonies from 2 different sets of experiments. And essentially, if you get a large number in any of these cells by one experiment, you also get a large number by the other experiment. So microbes and droplets are largely doing the same thing in terms of their dispersal associated with these different methods. by contrast with the jet air dryer, at the top of the table, you'll see very, very few droplets or microbes dispersed during hand drying with paper towels. This is data just to show the distance travelled by the droplets, or in fact the yeast particles in some of those experiments that I've just described, and essentially it's the jet air dryer in blue that stand out when you do this sort of experiment, with droplets, yeast particles being shed, disseminated, splattered is the word I often like to use, because that's what you can feel happening sometimes when you use one of these devices yourself. But you can see 2 meters was the sort of distance, up to 2 meters, that microbe dispersal occurred, 2 meters away from the jet air dryer. By contrast, very short distances associated with the other hand drying methods studied here, 2 different sorts of paper towels in pink and black, and the warm air dryer in red. So moving on, that's visualization, and I'm a great believer in seeing is believing. But of course, what can't you see? Well, you can't see the particles that are thrown into the air, that are dispersed, splattered, aerosolized. For that, to measure those, we need some form of air sampler, and this was the air sampler that Keith used, and we subsequently used the same sampler. And this, inside the sampler, during the sampling process, is a rotating disc, and the disc in this case contains a nutrient agar plate. So you could then subsequently work out, by counting the colonies that are grown on the plate, you could I apologize for that. You could subsequently count these and work out at what point in time, because this plate is rotating very slowly, were the particles liberated in relation, in this case, to hand drying. By doing that, again, you can draw up a table like this, and essentially the story is the same as the other table that I showed you. As you travel down the table from paper towels through warm air dryers to jet air dryers at the bottom, so the counts in the air of microbes, in this case, this was a bacteriophage, so that's a virus that affects bacteria. The counts of those increased very, very markedly, in other words, associated with jet air dryer use. And the time that you could detect these virus particles, the bacteriophage particles, were spread right the way through to at least 15 minutes. And these experiments didn't go beyond 15 minutes. And that's important, and I'll come back to why it's important later. So just interestingly, and this, I did say I was going to talk about some other studies that neither Keith's group nor mine had carried out, and this is one, and it's really quite a revealing study, and it's revealing because of the results, but it's also revealing because of what the authors did not go on to do. To become clearer what I mean in a minute. Importantly, the study was carried out in Bradford, as you can see in the top left-hand corner, and also importantly, the study was sponsored by a manufacturer of one of the manufacturers of jet air dryers, in this case Dyson, and they looked, as you can see here, at the relative removal of of bacteria microbes from hands. Rather oddly, this was how they put the microbes onto the hands. Well, the answer, and I don't apologize for them, is they got the volunteers to handle a piece of meat. Yes, you heard it. They handled a piece of meat. So there wasn't necessarily a standardization of inoculum, but then they dried the hands and then used a method to count what microbes were on the hands. And these were the authors' conclusions, not mine, theirs. 1, the jet air dryer, the air blade, was superior to the warm air dryer for reducing bacterial transfer. So they measured not only what were on the hands, but how easily what was on the hands could transfer to another surface. And that's what's referred to in this bullet. 2, in particular, rubbing with paper towels appeared to be the best means of reducing bacterial loading on the fingertips. And if you think about it, that just makes eminent sense, that by rubbing, not vigorous rubbing, but rubbing, drying, removing the droplets, you're also going to remove microbes from the hands. But very interestingly, the authors then speculated, and these are verbatim quotes, that there may be more of a story to tell about dispersal of microbes during hand drying. And they said they were going to go on to do further work to look at this issue. But it's not possible, and I've tried very hard to find any evidence that such work was done, or if it was done, it doesn't appear to have ever been published. And I leave you to draw your own conclusions about that. So I'm going to move on briefly to talk about a series of experiments that we have done, including some in vitro work, but also that real world study that I mentioned at the outset. What we did was a series initially of in vitro studies, and we started off by using black paint on hands, so dipped hands into the black watercolor paint, and then went on to dry the hands. And the beauty there is if you surround everything, including the person drying their hands, you coat them in a white suit, you put white sheets and so on around the dryers, then you can simply count the amount of black paint, the droplets that are distributed during hand drying. And I'll show you some pictures in a minute. And we did that, and these were the relative differences in the numbers of droplets that were liberated during the drying process. And you can see there, talking about at the top about bacterial aerosolization by the 3 methods, looking at counting now on the body of the person drying their hands, and also we measured, and I think you can just see it here, the relative differences in the amounts of droplets on someone stood behind the person drying their hands. Here's the one of the drying methods, a air dryer. Very easy to see considerable contamination of black watercolor paint around the dryer. And indeed, there are other pieces of paper beyond that photograph, and take it from me that we could see visible dispersal, splattering of black paint up to 1.4 meters to the side of this jet air dryer, and up to 1 meter in front of the dryer, to one side, 85 meters right in front, 90 to the other side. Contrast those distances and the amount of splatter that we could see associated with paper towel. So very few droplets and very minimal distances, as one would expect. So we're moving rapidly through the route map, the storytelling of the differences between hand drying methods. The next important part of the story is how do the different methods compare in terms of pathogen dispersal risk? Now we've touched on dispersal of yeasts in some of those earlier experiments in vitro, but what about real potential pathogens? And this is the real world study that I mentioned at the outset. And if you're going to remember anything about what I say, I believe this is the crunch data set, which I believe it's impossible to ignore. So this study was carried out in 3 places. In a pair of hospital washrooms, that's washroom A and B, here shown on this diagram, in Leeds, in a pair of hospital washrooms in Paris, and in another pair of hospital washrooms in Udine in Italy. So, and what we simply did was those washrooms were chosen because their hand drying methods were either paper towels or a jet air dryer. And the washrooms were switched backwards and forwards, and you can see the frequency with which that happened, and the 4-week periods of observation with 2-week washout periods in between. So this was a long study. This was over 3 months of study. Real world, no intervention, simply what could we find in those washrooms that were using either paper towels for people going in, washing their hands, drying their hands, or a jet air dryer. And what did we find? We found very significant differences in the amount of microbes, of bacteria recovered from washrooms where jet air dryers were in use compared to paper towels. And you can see the differences there with extremely small p-values showing the level of significance in this real world study. So the amount of splattering that was going on was fundamentally different during jet air dryer use compared with paper towel use. What about specific organisms, bacteria of interest? Second bullet shows much higher levels of methicillin susceptible Staph aureus recovery. It shows higher levels of MRSA recovery in the UK pair of washrooms. We didn't find much MRSA, and there probably was a lower prevalence at the time of the study in the Paris washrooms and the Udine washrooms. Same story for enterococci, or the same trend, and for ESBL producing gram-negative bacteria. So in other words, there were some subtle differences in how many MSSA, MRSA, etc. that we found, but the direction of travel was always the same. And that's shown on these 3 graphs. So you can see here at the bottom is at the bottom of this graph, or the clustering of the blue diamonds. Those are the total bacterial counts throughout this study period. You know, all we simply do is go in every day and take some surface samples. And these are the UK washrooms, and you can see the blue diamonds are when paper towels were in use. The orange squares, I think it is, when the jet air dryer was in use. Huge differences in the total microbial burden. France, the pair of washrooms, same picture. Udine, same picture. So, as I said before, whilst one can argue about how one will do in vitro experiments, whether, you know, how many bugs you might put onto hands, whether you rinse them, wash them first before you then try and dry them, whether you simply do a male hand wash, which is waft the hands, sometimes waft the hands somewhere near a tap and don't wash them properly. But with a real world study, that's what we found. Huge, significant differences in microbial burden, in the dissemination, in the splattering of microbes during jet air dryer use compared with paper towel use. What about seeing is believing? I'm just going to hopefully show you, oops, see if I can, yeah, right. So hopefully you can see this. This is the, I'm just going to pause it so you can hear what I'm saying. There are 2 beakers of liquid carbon dioxide, which of course, when that meets the air, it vaporizes. You see effectively a dry ice effect. And by using this, you can see, seeing is believing, where the air is dispersed when this jet air dryer is in use. Let's start again. I'm going to start. It does do the same thing again, but I'm going to stop there. But I mean, you can just see it's entirely consistent, that visualization, with the data that I've shown you about whether it's lemon juice droplets, yeast particles, or in the real world study, whatever microbes, Staph aureus, fecal microbes, Enterococci, ESBL, Enterobacteriaceae, that are liberated associated with this hand drying method. And of course, let's just be clear, a jet air dryer is using extremely high velocity air speeds, about 400 miles per hour. Contrast that with a cough, 60 miles per hour, or a sneeze. If you stand in front of somebody who coughs or sneezes, sometimes it's really unpleasant, isn't it, when you can feel splattering occurring from the person coughing or sneezing, particularly if they don't cough or sneeze in the right way to limit dispersal. So it's entirely intuitive, isn't it, that if you then multiply those speeds by 5, 6, 7-fold, that you're going to feel splattering as well from wet hands during a drying process. So, does microbe dispersal, is it an issue beyond the washroom, or is this just something we need to worry about during the washroom? Well, we did this series of experiments and it arose quite a bit of interest because you see the date on here, it shows a date 2021. We actually published these data during the pandemic. And we simply carried out some experiments in a real washroom where we got volunteers to dip their hands into a bacteriophage solution, shake them dry, and go and dry their hands with either paper towels or a jet air dryer. And then we followed them on a set route through the hospital onto a real clinical ward, and we mapped whether we could find the virus, the bacteriophage that was originally on their hands, to see where else it went outside the washroom. And what we found was very significant differences in terms of the surfaces that the volunteers went on to touch, because and whether that's touching with their hands or their clothes, which had become contaminated during the hand drying process. And we measured that, I think, quite simply by two simple ways. We got people to cross their hands over their trunk and then sit on a chair and the outer aspects of their arms, which had become contaminated during jet air drying, then contaminated the chair on which they sat on the ward, on the clinical ward. We also got volunteers to hang a stethoscope round a neck in true doc fashion, and then measured what was on the stethoscope. And indeed, the stethoscope, both ends became contaminated because of splattering of virus during hand drying. And you can see the differences in virus detection on environmental surfaces here, with much higher counts associated with jet air dry use than with paper towel use. But can that dispersal feasibly be inhaled, that microbe dispersal? So is this just about large droplets splattering onto your chest, and then potentially taken outside the washroom? Or can any dispersals, aerosolization, be inhaled? Well, we couldn't measure actual inhalation. It would be difficult ethically to do such a study, but we did the next best thing, informed, of course, by the pandemic. So what we did was we got volunteers to wear masks, face masks, tight-fitting masks, during the hand drying process after hands again had been contaminated with a bacteriophage, a harmless bacteriophage, a virus, harmless to humans. And we changed the mask every 5 minutes, but the person remained in the room for a total of 15, so 3 masks worth, 3 5-minute mask wearing periods after they dried their hands, which had been initially contaminated with virus, to mimic potentially someone having coronavirus still on their hands after hand washing or hand rinsing, or influenza virus, etc. And what did we find? Again, much higher levels of mask contamination, which here is a proxy for inhalation. So much higher levels of mask contamination during jet air dry use compared with paper towel use. And these were significant differences, as shown by the asterisks on these diagrams here. And these data here look at the different 5-minute periods that I referred to of mask wearing. And what do they show? They show that the inhalation risk, the mask contamination risk, isn't confined to the first 5 minutes. It's still there for the second 5-minute period. It's still there. And for the person standing behind the person drying their hands, the counts were actually higher in the third 5-minute period than the counts of virus on the mask, suggesting that what's been happening during hand drying is dispersal. Yes, large droplets. We've seen those droplets in the various experiments, but of small droplets as well. True aerosolization, because the big droplets will have dropped out of the air a long time ago, within seconds typically, but 10 to 15 minutes after hand drying, a fresh mask is still being contaminated with virus. And indeed, the counts were higher in general than in the first 5-minute period or the second 5-minute period. So that to me is really good evidence of aerosolization of virus during hand drying use, in this case with the jet air dryer. So one red herring, just to deal with quickly. Forgive the herring that's just flown in here. You quite often see comments in adverts, maybe stickers next to some of the jet air dryers, and this is not specific to one manufacturer or another, about the fact that the jet air dryers use HEPA filtered air. Now, of course, what that's referring to is the air that goes into the air dryer may be HEPA filtered, but it's nothing to do with what comes out of the air dryer. That's not filtered. And just think for a minute, could that air that's going through the dryer, particularly in a busy dryer that's being busy washroom with dryers going on and on and on many, many times, could those HEPA filters be effectively cleaning the air, removing some of those virus particles or bacteria-laden particles that we've seen or measured in the experiments I've just described? Well, we've gone on to do various calculations, particularly with a colleague, Michael Bull, who particularly did this work, so he deserves the credit for this. And we're in the process of submitting these data for publication. And the crunch data are in the fourth bullet in bold text here, that in a very busy setting, the most that those filters, HEPA filters, could be contributing to cleaning, removing microbes from a washroom is somewhere between 1 and 12%. In other words, for 90% or possibly 99% of the microbes in the air, those HEPA filters are doing nothing relative in terms of cleaning the washroom air, meaning those microbes are still available for contamination or inhalation. Now, I'm very nearing the end of my story, and really what I've got to say remains is largely show you a series of images just to drive home some of those differences that I've shown you, and for you to think for yourselves of the quite stark implications, whether you come from a healthcare setting, a food, hygiene setting, public health setting, whatever. Communication is everything, of course, and one can produce various infographics. Here's just one describing one of the studies that I've described today. But I believe pictures of real world settings drives home the messages effectively. In this case, remember this poster? For those of you from the UK, and we saw this poster, we still see this poster to this day, and it's about catch it, bin it, kill it. It's telling us how we should be sneezing to limit dispersal of microbes during sneezing or coughing. So all well and good, but it's a bit depressing when you see such a poster immediately above a jet air dryer in a washroom setting. I took this photograph myself in this washroom. Yes, I had to make sure there was no one in the washroom. Taking photos in a washroom is a bit of a no-no, but I think it's important to drive home the message. Remember those distances of droplet splattering that I showed you before? 1.4 meters to one side, a meter away in front of the jet air dryer. Remember those distances. Question for about half of the audience. Get me? Which half of the audience? Which urinal would you rather use? That's a jet air dryer on the right, and there's two urinals. This is a well-known food restaurant toilet. The distance from that jet air dryer to the first urinal, I would guess, is about 30 centimeters. I showed you the splattering distance that we measured before, 1.4 meters. Imagine if there's two people using these urinals while someone uses the air dryer. Need I say more? If you are a parent, would you want your child using the wash basin on the left in this public washroom in a garden centre in the UK while somebody was using the jet air dryer on the far left, remembering the 1.4 metre splattering distance and the height at which that splattering occurs. Would you really want to have your jacket hung on this helpfully positioned hook next to this jet air dryer? So this is where we are with the red arrow now. You know, it would be great to actually try and carry out the ultimate trial to work out whether people who dried their hands with jet air dryers as opposed to people who dried their hands with paper towels suffered more infections as a result of these risks that I hope you now understand that we have measured and demonstrated. That experiment, that trial, if you think about it, would be a nightmare to carry out because of all the confounding, you know, who only uses paper towels, who only uses jet air dryers when they're drying their hands. And of course, there's lots of other reasons why someone might acquire a respiratory tract infection, sore throat or whatever. And so at this point, we've been unable to design such a study. But, you know, there's the parachute principle here, isn't there? Do we need to do a clinical trial to demonstrate the importance of parachutes? I don't believe we do. I'm not going to show you this video, but if you were to search for this news article, if hold on, let me just see if it will work. Yes, it will work. So I'm just going to stop this. I need to share my screen in a different way, and then you'll be able to see this video. And this is the end of my my presentation. So it should be this video here. Hopefully you can see this.
You do your business, flush the toilet, and in theory give your hands a good wash. The problem is too many people are taking shortcuts. Research in hospital toilets has shown just what's being splattered around, including fecal matter and dangerous bacteria.
People just sort of think, well, you just dry your hands, end of story. But actually that's not the case. Most of us wash our hands not perfectly, the bugs are still there. So when you dry them in the jet air dryer, the droplets are splattered into the environment, onto the machine, onto the floor, onto you, into the air.
But paper towels are said to absorb the water and microbes instead. And the study carried out in 3 hospitals revealed that bacterial contamination was significantly higher on the days hand dryers were used instead of the disposable tissue.
We may not be in a laboratory, but by doing a simple experiment using this bulb and some liquid which glows, we should be able to see just how far germs can potentially spread. You can see just how far along the wall it's spread. Pretty unsurprisingly, it's also dripped down the side of the dryer, but also onto my handbag.
It's not good if those splashes are contaminated by microbes.
Some of the germs that could be passed around include E. coli, and there are different strains of E. coli. Some are classified as toxigenic, and if someone was to ingest those, then it could lead to a rapidly deteriorating situation that could even cause a fatality. I think it should take about 20 to 30 seconds to wash your hands.
Hand dryer manufacturers point out the problem is in the washing, not the drying of the hands, and that the research has been funded by the paper towel industry. There's also the fact that used tissue needs to be disposed of. It doesn't help that we're all in such a rush.
So you wash your hands and then stick them onto the dryer quickly and then actually take them away before they're dried properly, because actually, you know, it's a bit of a bore standing there until they're properly dried, and then you kind of rub them on your jeans.
The problem is you can't see what lurks within the droplets of water. Only by washing thoroughly every time will germs be stopped in their tracks. Emma Birchley, Sky News.
So, I hope you didn't mind me showing you that real Sky News video, which is still available online to this day, because that was after we published that real world study that I spent some time describing. I hope you've enjoyed the presentation, and now we've got up to half an hour left for questions. Thank you.
Brilliant, Mark. Thank you very much indeed. It's probably certainly we've been looking at the comments within the chat room, and most of those comments there are very, very good and very, very welcoming. But there's a lady who's come on that just says unknown user. So I'll ask you the question, Mark, and I'll read it out in full. It says, we predominantly use paper towels. However, in mental health settings, we have to use hand dryers as patients constantly block toilets with paper hand towels, and the roller towels are likely ligature risk. With warm dryers, patients won't stand there for 1 minute drying their hands and could potentially spread microbes if they've not dried down properly. With jet, there is obviously more splatter of microbes. So what advice would you give in that situation?
Yeah, and look, I think it would be unrealistic to try and say that jet air dryers don't have any role whatsoever to play in terms of hand drying. I think there are ways of designing jet air dryers that could remove some of this risk or lessen this risk, but at the moment, a lot of the jet air dryers one can see around, we've tended to concentrate on one particular model, which is probably the most common one that one sees, certainly in the UK, have not designed out the risks that we have described. In that particular situation, I get what the person is saying about the blockage risk potentially associated with paper towels. Actually, there's a way of minimizing that, though, isn't there? And that's by somehow designing things so that the paper towels are not thrown down the toilet. So you make the drying area well away from the toilet. And also the reason why in healthcare settings, let's be clear, why blockages tend to occur is because the pipes become gradually, the lumens of the pipes, the drainage pipes, become gradually narrowed over the years because of biofilm buildup. And good maintenance can reduce that biofilm buildup, reduce the blockage risk, and therefore make paper towels, in this case, still a viable alternative. But I understand there's got to be a risk-benefit analysis for each situation. That's a very special situation. But thank you for the question.
I know that Mark C has actually put up a link to, which will probably answer the next question, but I will ask it to you anyway, Mark. You spoke about dispersal of yeast lemon juice information. Debs has been on and she wants to know, is this information from one study or from a collective of studies?
So the lemon juice data, there were a series of experiments that were carried out. But they are available in a report, but it's not just one experiment, it's multiple experiments. They are available. You can get those results online, and I think Mark with a C has posted the link to that. But I just need to stress that whether it's lemon juice droplets or black watercolor paint or yeast microbes or bacteriophage particles, the results are all very, very similar, and all the results are available, and the links to where you can find those will be in the chat.
Another question, Kelly Payne, excuse me, Kelly's come on. What are your views on JAD at airports? Do you know from the evidence that it will eventually be taken away from all toilets at airports?
That's a good question. I don't have inside knowledge about what the views are there of those JADs. What I can tell you though is that certainly, and perhaps not surprisingly, not surprisingly, during the pandemic, quite a lot of institutions in different settings, and I'll come back to one particular type of setting in a minute, did remove or jet air dryers or switch them off. Why would that be? Well, it's obvious, hopefully, from the data that I've shown you today and the risks of virus SARS-CoV-2 dispersal during the pandemic. But of course, those risks of virus dispersal still exist to this day with SARS-CoV-2 and other viruses. In healthcare settings, in the UK, I'm aware of multiple hospitals that have removed jet air dryers from washrooms used by the public, plus or minus healthcare workers. I'm also aware of countries, including, now let me get this right, France and Germany, and there is one other, and I forget which it is, but Mark with a C will probably remember. There are 3 countries in Europe where they have outlawed, if I could use that term, the use of air dryers, jet air dryers in healthcare settings. So that's been written into guidance saying not to use those types of hand dryers in healthcare settings. France, Germany, and one other. Forgive me for not remembering the other country.
I'm sure Mark C will know. We've got a question from Joanne Mason. Hang on, let me just get that back up. Has there been any research as whether jet air dryers cause eye infections, especially to shorter people?
Excellent question. No, is the answer. Of course, it's a bit like those the trial I was referring to at the end, where we have spent a long time trying to think, is there a way we could do this sort of trial? And of course, those shorter people using air dryers will be potentially doing other things, contaminating their own eyes with their own fingers, and so on. And so trying to do that to get to collect such data, it would be extremely difficult. Just say, but we've even thought, I've thought about trying to study a cruise ship where we convince the cruise ship company to put paper towels onto the starboard washrooms and jet air dryers onto the port side washrooms, and then during the long cruise to try and collect data on respiratory tract infections, perhaps diarrheal disease and so on in people with accommodation on one side of the cruise ship versus the other. That's the closest we've come to try and studying this. I think it's quite a good idea, but convincing someone to actually do this, and even then there's confounding, of course, because you don't confine yourself, do you, to one side of the cruise ship or the other. I'll pause there.
An unknown user's come on as well, and again this will be for you, Mark. From a sustainability impact within healthcare, was this the driver to move to dryers? Also cost improvements, how can we turn this back to paper? Yeah,
well, look, like everybody else, and particularly like probably the questioner, I'm interested, very interested in this whole sustainability issue. I'm not an expert on it though, and my view on these arguments in this case, whether paper towels versus jet air dryers, which ones have greener potential, it depends where you start the story. It depends whether you're including all the plastic and metal and other things that are used to manufacture a jet air dryer. It depends, of course, on the way the paper is sourced, whether it's recycled, etc., etc. And I just don't know, quite frankly, which is the greener of the two. Having said that, I would like to think, and I know this is true, that there has been quite a significant move to using recycled paper to make paper towels and other paper tissue products. But suffice it to say, I don't believe that the decision to use one hide drying method or the other is driven by sustainability argument. I believe it's been driven up until now by people making decisions ignoring or ignorant of the risks that we've talked about, but instead potential convenience arguments about not having perhaps to restock paper towel dispensers, about not having to empty the bins in a washroom. But quite frankly, what we should be doing is thinking about the whole story and what are the consequences in a restaurant of using one method that potentially can disperse microbes throughout the washroom and beyond in the restaurant versus another. I don't believe we should be confining this to simply convenience issues. Over.
Kerry Spencer wants to know, did the research show that there was a specific type of paper towel that was more effective, as in materials use, or whether the paper itself was rough or smooth to touch?
There was one set of experiments, and I did briefly show it, and it's where I showed the graph and how good the methods were at absorbing water. And that particular experiment, I think, studied it might have been 5 different sorts of paper towels, and they were all very similar at absorbing water. What we all know is that some paper towels are better at drying hands than others. We know sometimes you have to use 1 paper towel, sometimes you might have to use 2 or 3. We haven't studied that issue, but it is a relevant issue to get people to dry their hands properly. I get that.
Another one here, again, an unknown user. Does any of the study consider whether jet air dryers disperse any risk from hands after doing a good hand hygiene technique and after a proper rinse? They presume that the wet hands are clean.
Yeah, well, and I agree with the questioner that if we're looking at perfect hand hygiene, then the difference in risk between microbe dispersal with the jet air dryer versus paper towel, that difference is going to be much smaller. We're still going to get those droplets sent 1.4 meters at least, the big droplets to the left or the right, 1 meter in front. There still will be bugs on the hands, even with perfect hand hygiene. But yes, there'll be fewer bugs, and so the difference in risk will be less. The problem, of course, is, just stop and think, how often do you see when you use a public washroom, whether it's in a hospital or a restaurant, or how often do you see perfect hand hygiene? I can't remember the last time, quite frankly, that I did see that outside of a hospital washroom setting.
Isabel Solomon wants to know, where would the use of alcohol-based hand rubs fit into this, given all of the identified risks from different methods of hand drying?
Okay, so, but clearly hand hygiene has been revolutionized, quite a strong word, but I think it's appropriate, by the availability of alcohol hand gels and liquids and so on over the course of the last couple of decades. But their use, let's be clear, their use should be for hands that have not been grossly contaminated. So these are for ostensibly clean hands that will have low microbe, in general, low microbe burdens. That it's in that setting where alcohol gels should be used. But in a toileting situation, we're now no longer talking about potential low microbe burdens on hands. We're talking about fecal organisms, etc., etc. And an alcohol gel is not appropriate in that setting. It's soap and water, good optimal hand hygiene and optimal hand drying that should be used.
We've got time for just one more question, but it's not a question, actually, it's a statement, and probably get your thoughts on this, Mark. It's a lady called Karen Sanderson. How about the location of the bin in relation to the air dryer? We saw the videos or the pictures that you were showing. I've seen a bin under air dryer in a public place, and she's emphasised not in a hospital. She's personally moved it and seen it in the same spot the following week, having been moved back to where she moved it from.
Yeah, and so by the sounds of it, that's one of the relatively uncommon scenarios where more than one hand drying method is being offered, because all too often now it's one method and one method only. You know, if I'm offered a choice of an air dryer of whatever type and paper towels, I think you'll know which one I choose. Now, but in that particular setting, you're absolutely right that there's a sensible place not to put the bin, and that sensible place is anywhere within that zone of splattering, and from the air dryer. And of course, the air dryer, in that setting, could be then splattering and moving microbes that are on the paper towels in the bin. So you are quite right that if I'm assuming this is what you mean, you've moved it further away from the air dryer, because that's where the bin should be. I'd like to say that the air dryer shouldn't be there, and just the paper towel dispenser is what would be my ideal from an infection perspective.
And she's actually come back on, Karen, and said it was in a well-known drinking spot. So,
oh dear.
Well, yeah, I mean, it's been absolutely brilliant. Thank you very much indeed. I'll finish off with a comment made by Jane Hewitt. It was very early on in the conversation, and she said she's always preferred paper towels. You, Mark, have confirmed that this is the right decision. So
thank you,
excellent.
Jane.
So my thanks to our panelists, to the two Marks today, for their excellent presentations. Unless, Mark, you want to add something, we've still got a couple of minutes left. Mark C. Can you put your microphone on?
No, I think this was an excellent presentation. Thank you very much.
Well, once again, my thanks to the both of you for the excellent presentations. Hopefully you guys have taken something from the webinar. Any questions that we haven't answered, I think we have answered them all, they will be forwarded to our speakers and they'll endeavour to answer them by email. And we've had a few questions about, can they watch the webinar again? Certainly you can, if you'd like to watch it again at your leisure. It will be available on the Nolex website from Friday the 26th of April. All you've got to do is go to www.nolex.co.uk, click on the webinar banner, and it will be there. Thanks again, gentlemen. Thank you to everybody else that's joined us. And oh, Mark, by the way, enjoy your time down in London. Mark W, enjoy your time in London getting your OBE.
Oh, that's very kind. Thank you. I will.
Congratulations.
And congratulations. Thank you, guys. And we'll see you again soon. Thank you. Bye-bye.
Bye-bye.
Bye.